Greetings again. This is Dr. Bill Wyatt, and I wanted to talk to you this morning. It's morning here right now, and this is not just for adult orthodontics, but it really counts on any kind of orthodontics, but it is used on adult orthodontics more than a little. And I want to draw some things here just for a minute and kind of show you when you move a tooth. All right, we want to separate this palate on this person. Now the bone has been carved away up in here in this area, and so I'm going to just assume the bone is back in there. Well, let's start out. I talked to Donald Timms. He was the guy that came up and wrote the book on palatal separation, where you separate the teeth like that. And I asked him, he was speaking in New York, and he's from England. And I said, how old can you separate the teeth on a human being like this? And he said, well, about 17 or 18. And there were a lot of people there wanting to talk to him, so I just said thank you and turned and left. But I had been separating people in their 30s and some in their early 40s, where we could push the bone apart like this. And what the reason we could do that is that we put the pressure in different places. It wasn't just in the palate. I'm going to go now to this little white screen and show you. Like if we were separating the palate, and if we got it going something like this, and we wanted to separate all the way back here. So the palatal separator is put back in this area, and you've got a molar tooth, a bicuspid, and around like this, the bicuspids. And those are banded. They have to be banded to do this right. And you make a thing come in here, and it goes to these two, and then another one over to this. And if you got a second molar back in here, you can run it over to that. Now, and those need to be banded solid. And you could come in here with this going like that. And this thing opens out in the center and pushes sideways on these teeth. Now, when you take a tooth and you're pushing, if the teeth are banded firmly, and you're pushing them and the bands are cemented in, as you go out, they tend to tilt this way. You're pushing them here, and the tooth goes. Now this part is in the bone structure, and this is in the air. And so we're trying to transfer the pressure to the bone structure, so they're cemented really firm. Now, if you're building these things and you put a bar in here, that just doesn't work. It will separate the tooth, the crown of the tooth, but it doesn't the other part. Now let's just say we draw a tooth in here, and we draw one over on this side, and we come in here with this palatal expander deal, and you bond this to a bracket, a band that you got on this tooth right here, and you bond this and you separate this out. As I separate that, it goes out in this direction. Now I press it back together and cement the bands in, so the pressure is going in this direction. Now, we've got to remember that these roots of these teeth are up in the bone structure. I'm just pretty sorry drawing there. Now, as that tooth goes this direction, it really sways like this. It straightens out. And the band that's on there, it goes this way. So it moves the roots of the teeth lingual, because they're in bone structure over here, and you're pushing down near the air. That tooth's going to always move that way. So we've got to make the root go in the direction that we want the crown to go in, so that the tooth doesn't just separate out like this, it goes this way. So a palatal separator is much better if you keep the teeth really banded and they're rigid, and you push apart this way, the teeth go across bodily. In other words, the tooth is spread out in this way, the roots along with the band. But the teeth will tilt a little bit as you go, and if you wear this palatal separator for 6 or 8 months in there, you're going to have the lingual cusp of these teeth will be touching more than the buccal cusp. So if we draw this tooth over here, let me see, I have to get my little deal going again here. If you draw a tooth here, and you have your lower tooth should be right in here, and your cheek is out here, that keeps you from biting the cheek. Now if I just push this tooth in this direction, the roots, if I push here, and the roots are going up in this area right here, that's a little better. As I move the crown in this direction, the roots are going to rotate somewhere in the bone structure. So the tip of the root will move back in this direction, and the crown will move out here. Now that makes the lingual cusp. The tooth will look like this, and the bottom will be hit like that. Now, if you hold it here long enough, chewing on this lingual cusp will make the roots go over in that direction. That's the way crozet people expand the palate. They have to stay there so long that it's terrible. So we want to do this and get it done as fast as we possibly can. So we put what we call buccal root torque. I'm going to erase this just for a minute here, and let's go back, and I'll make another deal here. Now, let's just assume that we've got a tooth that's sitting here, and we're going to draw roots on it. And if you start to, and you'll be separating another one over on this side, like that, and you're putting pressure on this. The Big Daddy arch wire is a ridiculous name, but anyway, that's what they call it. We can put any amount of pressure we want going in a lateral direction, like that. Now, if you just tied the wire in there and put it up here and pushed it over, and you can put any amount of pressure you want to. You can have that wire straight, push it in like that, and it puts a tremendous pressure. Well, what it would do, the crown would move in this direction, but the roots now are in bone, and so they're going to rotate some point in here. So as the crown moves in this direction, the roots are going to tend to move the tips of the roots in that direction. The tooth will lean over, and then it'll be chewing on this lingual cusp, like if we had it like that, and you tilt this tooth, then this lingual cusp is going to be hitting. Now, we do not want that to happen. We know if we pushed it out there and we stayed long enough, which when we put palatal separators, we wear them several months after, even though we've got the bands cemented real good, we stay with that palatal separator for 6, sometimes 8 months. They wear that thing. And during that time, the lingual cusp takes the blow, and if the tooth is lean this way, it'll make the tooth go parallel, all right. But we don't want to mess around and wait to take it that long. So I'm going to clear this just for a second here and go back to this white nail. So here's what we do. We've got the roots, and the tooth is coming up in a root structure like that. Now, we are separating these teeth. We are separating with a palate, with a big daddy arch wire. We're going to put this wire out here. We make it to fit the arch, and then we bend the wire out and put every amount of rotation we want. And you can take a Orthodontics gauge, you can pull this one over to this side, and this one will be out here, and you push on there, and you can tell exactly how many ounces of force you've got on this tooth to move it in this direction. And then you put it here, and it's that same thing as over on the other side, over here. So we know that we can separate anybody, just putting that much out there, we can separate the teeth. But we don't want to just separate the crown out here and have the root go over here. We want to carry the root with us. So we have to use what we call is progressive root torque. In other words, you take your arch wire, and I hope you can maybe see this. Say your arch wire is something like this. This is the heavy arch wire. It goes out here. And we're going to make it fit the teeth to start with. It's going to fit in here, but then we'll take that wire and bend it out where it would be something like this. And now we push this in, or you tie this up here and push this one in and measure the amount of force, and it'll tell you exactly how much lateral force is going on that crown. And if you left it alone, it would tilt those teeth in this direction. And the roots are going to go in because the roots are down in the bone here, and it'll rotate somewhere along in here. So you'll know it's going to do that. So we have got to come in with a rectangular wire. So whenever you're using this big daddy arch wire, you need to be using a rectangular arch wire especially. Now if your teeth are leaning this way, you can just push them out that way. That's just a little bit, and you wouldn't have to do this. But if you're sitting there like this and you want to go out here, like some of those cases we've shown you, then you need to put this buccal root torque on the tooth. And it's got to be progressive. Now, so you have to think about the tooth. Just think in your mind in the 3 dimensions here. This is a tooth. It's sitting up here. And we're going to put a bracket on the side of that tooth. This goes out, and it'll have a slot maybe so wide right in here. Now we take this arch wire and we grab that. This is just the regular arch wire, the rectangular wire that you use with the Big Daddy. You catch it behind the cuspid tooth, and you twist that wire like the wire's flat. Coming right here is this rectangular wire, and we catch it right behind the cuspid, and we twist that, we catch it with one pair of pliers and hold it. And now go back to the end of the wire back here, and sometimes you can turn this up and you can catch it. That's the Big Daddy arch wire, but you catch the rectangular wire and you twist it. In other words, it's flat all the way back now. I grab it here from the other side and I twist the end of it like that. And so the wire will go progressively from the bicuspids. It'll tilt a little bit, it'll be more and more, and it gets out here to the cusp, to the molar. It'll be laying about like this. Now, if I twist that wire back up and flatten it out and stick it in this gap right here, I put the wire in the gap. Well, I have to take my hand off it to do that. I put it in the gap right there. Now you can see here's the space in the bracket. Here is the wire. I twist it and I put it, if I turn it loose, it goes down this way. So I put it in here. Now it's going to do this to the tooth. If you're rotating or moving a tooth by torquing a wire, then the point of rotation is right in the bracket, right here. So it's going to tend to move this tooth in this direction. Move the roots are going to go that way because they're going to rotate here. If you leave it in the arch wire in there in the air, it'll move the crown in the wrong direction. Now, does everybody see that? We put this stuff out about these Big Daddy arch wires that you can do just darn near anything you want to as far as lateral expansion. Whether at any age you want to, you can do this. Now, I mean, you can expand the palates on people in their 70s and 80s and I guess 90 if you put it in there. You just leave it. It'll gradually go out that way, but you've got to put this buccal root torque. And so the wire would be, here's your gap, your wire would be here. You twist it back now, the wire wants to go in this direction. So put it in here, and it's going to tend to rotate the tooth in this part, rather than if I pushed on it, it would rotate around the point here. So it tends to push the roots out there. So we put enough force on the Big Daddy arch wire in here that it cannot move the crown of that tooth lingually. So this buccal root torque that you put in here becomes buccal root torque. Now this big wire will bring the crown out regardless, and this buccal root torque that we've got in the rectangular wire will bring the roots out. So we can take a tooth and put this torque on it like that, and it tends to move the tooth that way. And when you're using the rectangular wire in a bracket, your point of rotation is the bracket and not the point up here if you're just pushing on it. So if we just push on this tooth, if we push it out here, it'll rotate on some point up in here rather than the bracket. Now, I hope to God you understand this, because if I just shove on a tooth, it's going to rotate somewhere in the bone structure. I don't give a darn who you are, what color you are, what nationality or religion or anything is, the teeth move that way. And if you're pushing into trying to do this with a round wire, just a bar up against the tooth, the roots move opposite from what your pressure is in there. So you've got to go in with rectangular wire and put this buccal root torque, and we call it progressive. And the way you put it, you grab the behind the cuspid and catch it out here and twist that wire way down like this. And now you turn it loose and it flops back. And you twist it until it flops back and it's about straight up and down like this. And now I bend it up and I stick it in the bracket slot, and it's going to do that to that bracket slot. That's where it's going to try to rotate. And so it brings this pressure up to the roots, and now you do not let the crown move. Lingual, you have this big wire out here that you can put any force you want to. And if you see the tooth moving and you see the lingual tooth touching down here, and you know that you're coming too much force on this, not enough on the roots, you either add the buccal root torque more or relax this wire, and so the tooth moves bodily. In other words, you just take the tooth, and here it is, and you got the roots going up like this, and this tooth will move over. Here we need more torque to get this root straightened out to start with. But you look at how the upper teeth now are supposed to meet over the lower teeth. And people who are mouth breathers, their tongue is down here in the bottom, and they widen their teeth out, and their teeth don't meet like this. They'll have the upper molar will be here, and their lower molar will be like this, and they'll bite their cheek, and these go into cross bites, and that's why you have so many cross bites. So people talk about mouth breathing and don't even mention what actually happens to the facial structure if you're a chronic mouth breather. You're going to widen the lower arch out, and the upper arch won't get the pressure it needs, and it'll be hitting like this right here and there. Now, this gets pretty complicated, but this is not only works in adults, it works in children or young people or anybody. It doesn't matter who you are or what age you are, the pressure's still there, and you can spread the teeth out in that direction if you know how to put this progressive buccal root torque. And that buccal root torque, you can't take the arch wire and spread it. It doesn't have enough power. The torque in there overpowers the lateral expansion pressure of the arch wire. So you have to have something big on the outside to make the tooth go where you want it to go. So I hope that this gets across to people who's ever, if you're interested in really moving teeth right, we're interested in trying to teach you that. If not, just go to another page. So I hope you got something from this, and I'm going to sign off here and say, join our channel. We've got 3 channels now, about for pediatric stuff, some for the adult stuff, and some for just everything. So thank you for watching, and I'm going to close off.